Hey guys, so I wanted to make this video to kind of clarify and talk about something that I told you guys I would make a separate video about in a video that I made earlier in the week. So tomorrow I actually start my clinical orientation at my new job at the new facility that I'm working at. And I had mentioned in the video where I was doing like the general new hire orientation that I plan on this job that I'm like clinically starting tomorrow being my last CNA job. And so I wanted to address that just because I feel like people had some questions. I did get a couple of messages about why I said that and what I meant, and am I leaving the medical field and things like that. So I just wanted to answer all of those questions for you and kind of elaborate a little bit more on what I meant when I said that. So no, I'm not planning on leaving the medical field, and it's not because I don't love interacting with my residents and my patients. It's just the simple fact that CNA work is too hard for me with my medical issues. It takes a lot out of me. It's very physically demanding, and it's just a lot of stuff that you have to deal with when you're a CNA that I don't necessarily think is good for you when you have multiple chronic illnesses like I do. So no, I'm not leaving the medical field, but I am researching different ways that I can still work within the medical field but not have such physical responsibilities. So what I've really been looking into most recently is becoming a medical assistant. And the reason why I'm interested in becoming a medical assistant is, one, medical assistants usually, for the most part, have more normal hours. You know, there's not all of these like day shift, evening shift, night shift. I mean, there may be, but for the most part, medical assistants work like normal business hours, unless you work for like an urgent care or some type of setting where they're open 24 hours a day. For the most part, most doctors' offices where medical assistants would work would be, you know, normal business hours, Monday through Friday, maybe the occasional weekend day or something like that, depending on the doctor or the facility that you're working for. You're not moving patients or residents back and forth and rolling and pulling and, you know, transferring and helping with all of that very, very physical stuff for your entire shift. There may be certain people who you have to help, you know, with doing certain things, but for the most part, medical assistants don't have to participate in those types of things because they're more vitals and injections and, you know, assisting the doctor with whatever they need assistance with. And, you know, a CNA is very, very physical, whereas a CMA or an RMA, whatever, you know, type of medical assistant you are, they have things a little bit easier as far as physical wise. I'm not necessarily saying that medical assistant is an easier job than being a CNA, because I think that every job has their own difficulties and their own stressful things that you have to deal with. But as a CNA, I never thought that I would be working as a CNA as long as I have been. This is my third year working as a CNA, and my intent was never to stay as a CNA for as long as I have. The one thing about this current job that I'm starting clinically tomorrow is I absolutely love memory care. You guys know that that is the whole reason why I got into trying to become a CNA in the first place. You know that that was my passion from the very beginning. My very first CNA job was in memory care, and now I was just offered this position within the memory care setting as well. So I just think that it's time for me to really focus on moving up the ladder a little bit, and not necessarily that, you know, you would go from CNA to medical assistant. That's not necessarily on the same level. You know, normally people would go CNA to like nurse and up that way. But I feel like locally there are programs where you take a few months and then you are able to work your way up into a medical assistant. Now, the program that I've been looking at is a 5-month program. So it starts in the spring. So by the fall, I would be able to do the national test for medical assistant. Now, the reason why it's so interesting to me is because they do make a little bit more than CNAs do per hour, even within like the local area, but definitely within the bigger cities. I feel like it just offers me so many different opportunities. I could work, in a doctor's office. I could work in urgent care. I could work, at the clinics within the hospitals in the area. There are different travel positions that you can get as a medical assistant, where if you have the phlebotomy training and you know how to draw blood, you can work at like mobile wellness clinics and things like that. It's just so many more opportunities than just having to limit yourself to, basically hospitals and nursing homes, which is, I'm not saying that there's anything wrong with working in hospitals or nursing homes, but when you've worked in the nursing home setting for as long as I have, not even necessarily as long as I have, but when you work in that field, it can get very emotional. And sorry if it's kind of hard to hear me, the heat just kicked on. But, it takes a lot out of you to constantly go into this type of setting where you're seeing people who their family isn't coming to visit them, and, they're alone, they want companionship, and they just want somebody to come in and talk to them, and you don't even have the time to come in and talk to them because you have 20 other people to take care of. And I just want different things for myself. Like I said, I love what I do. I love being an advocate for my residents, and I will probably maybe, I don't know, but I will probably keep like a PRN CNA position just because I love interacting with elderly people, especially those in the memory care setting, whether that's with a local facility or whether that's with an agency, I don't know, but I will probably keep some type of CNA position at least for a little while, until I get like into the rhythm of things with being a medical assistant. But for now, I just think that it's time for me to move on from being a CNA and hopefully move on to bigger and better things. So that's why I said that I want this new position to be my last CNA job. It's not that I necessarily hate being a CNA, because I don't. It's not that I hate working with the elderly, because I definitely don't. I love interacting with my elderly residents, especially those people with dementia and Alzheimer's. It's another beast. Long-term care is it's a beast of its own, and it's just, sometimes it just gets really overwhelming and we need to take a step back. So I hope you guys can understand and don't judge me for this. I just want to move into a job where I'm more physically stable, financially stable, and I'm happier because I'm able to work more normal hours and just enjoy life. So with that being said, that's all I have for this video. I hope you guys enjoyed. If you have any questions about anything that I said, let me know. I don't want to scare anybody away from being a CNA, because I definitely think that it's been one of the best positions that I've ever had in my life. I think that it's one of the best choices that I've ever made as far as career-wise, but my intentions were never to be a CNA long-term. It was always either nursing or something else in the medical field. And I'm currently on a break from nursing school. I took this semester off to try to figure out if I actually want to go into nursing or if I want to pursue something else within the medical field, whether that's physical therapy, pre-med, PA school, anything like that. I'm trying to understand exactly what I want to do, because I've been talking to some of my friends who are medical students and PA students, and you know, it's different. So I want to make sure that I'm making the right decision for myself before I actually commit to the nursing world, so to speak. So yeah, if you guys have any other questions, any topics you want me to talk about, leave them in the comments below and I will address them. If you're interested in following me on my journey towards becoming a medical assistant, let me know. I'd love to make vlogs for you about the training process and, you know, the job hunt and all that stuff when I'm done with training, just like I did with my CNA training. So let me know and I'd be glad to, you know, keep you guys in the loop as far as that goes. Like I said, I am on a break from nursing school until I decide that either nursing is for me or it isn't for me. So this video has gone on long enough and I will talk to you guys again in a couple days with my next video.